Important news for women living with menopause and hot flashes. Dr. Nancy Gaba is here to discuss the just-approved drug Brisdelle for women who can't take hormone treatments. Doctor, what is Brisdelle?
Brisdelle is Paxil. It's Paxil repackaged into a form that's been approved by the FDA for treatment of menopausal hot flashes and what we call vasomotor symptoms. Paxil is an antidepressant. It's one of the most popular antidepressants out there. Brisdelle is a lower dose of Paxil purposed for the treatment of hot flashes.
And the difference is from previous treatments is that there's no hormones in this?
There's no hormones in this, which makes it very appealing to certain categories of women. Some women just don't want to take hormones. Some women can't take hormones. For example, they've had breast cancer or they've had problems with estrogen in the past. So this is a good alternative for women who are unable to take estrogen, which is, of course, the best treatment.
Are hot flashes something that's misunderstood?
Well, hot flashes are a very common menopausal symptom. Up to 75% of women going through the menopausal period will have hot flashes at some point or another. Misunderstood is hard to answer because sometimes a woman will turn hot and red and sweaty in the middle of a very inopportune time, for example, during an interview. And if that happens, she may feel embarrassed. People may misinterpret why she's turning red. They might think she's angry or upset about something, but in reality, it's a symptom that she can't control.
But they can be severe?
Every woman experiences hot flashes differently, and for some women they can be very severe. A woman can have multiple hot flashes in 1 hour that can keep her awake at night. It can affect her quality of life. It can affect her ability to do her job. So in some cases, hot flashes can be severe. Some patients report just mild hot flashes. They notice that they're having them, and then they go about their business.
And how many years are we talking about here?
For most women, hot flashes last about 3 to 5 years, but for some women, the symptoms of menopause, including hot flashes, can last for up to 10 years. People get hot flashes because of the changing hormones in their system. The hormone estrogen, which is produced by the ovaries, has significant effects on the person's vascular system, and the hormone estrogen also affects a substance called neurotransmitters, which also affect the blood vessels. The long and the short of it is when those substances are diminished in your bloodstream, it can make your blood vessels contract and relax, and that relaxation of the blood vessels is what makes a woman get a hot flash. Suddenly she feels warm, hot, red, and she's having a hot flash.
Now, one of the things about Brisdelle is that an advisory FDA panel didn't approve it or didn't recommend its approval, and then the FDA just recently approved it.
Doctors have been using Paxil-like medications in the category of SSRIs, or selective serotonin reuptake inhibitors, for many years for the treatment of hot flashes. So I think this was just something that was a long time coming.
Was it a surprise that the FDA did this?
No, it's not a surprise. It's a pretty debilitating condition, like you mentioned before, for many women. So I think it's about time that people acknowledge that women are really suffering with this condition.